Hi, everyone. Thank you for joining. I know that there are people here from diverse fields, so I'll provide a little background first. My name is Bianca. I'm a student in the Honors Psychology program at McGill. This research was supervised by Dr. Richard Kessner, who is the director of the Human Motivation Lab. We work with self-determination theory, which is concerned with understanding how people and our social context and environment can either support or frustrate our motivation. And our lab has a strong working relationship with the Black Community Resource Center in Montreal, which is a nonprofit organization that helps the English-speaking Black community achieve their potential through various programs and workshops. So because we know that the Black community have been hit hard by the COVID-19 pandemic and experienced the highest mortality rates in Montreal, and also that there is a lack of research involving the specific needs of the Black community, we wanted to help them address some of these needs. Now, according to self-determination theory, there is a concept called autonomy support, which is when someone acknowledges and is understanding rather than demanding. Being on the receiving end of autonomy support promotes a more autonomous form of motivation compared to a more controlled form. So for example, if you talk to a doctor who's in a rush and tells you what to do, that's not being autonomy supportive. And that would not increase your motivation, and you may not even want to do what they tell you. But if a doctor is listening and open to hearing your concerns, then that would be beneficial for your motivation. So receiving autonomy support from others is linked with healthier outcomes in general. The aim of our research was to explore differences in how the Anglophone and Francophone community rate their healthcare satisfaction, and also to highlight the importance of autonomy support from a self-determination theory perspective. We recruited 445 Black participants from Quebec and administered an online questionnaire. We asked them to rate their previous experiences with doctors, and we also asked them to rate the level of support from society towards their group. So we asked about individual support from their doctors, and we asked about collective support towards their group, because we know that the Anglophone Black community is subject to high levels of discrimination. We wanted to contrast the two types of support from a personal and a group perspective. And we can see from the graph here, orange are Black Francophones and the blue is Black Anglophones. Anglophones reported significantly less satisfaction with healthcare services, and they also reported receiving less COVID-19 information. And this is an important finding because it shows that there is a need in the Black Anglophone community. Then we compared personal and collective support. The good news is that both language groups reported high levels of support from their doctors, which is really great. However, Anglophones report less collective support from society compared to Francophones as a group. Then we wanted to see if language and autonomy support were involved in predicting healthcare satisfaction scores. So we ran a hierarchical multiple regression controlling for autonomy support from doctors, because we knew that was already high for both linguistic groups. And we found that autonomy support from doctors was a strong predictor of healthcare satisfaction, which is what we expected. And we also found that collective support was a positive predictor of healthcare satisfaction, but that being Anglophone negatively predicted healthcare satisfaction. So since personal support is high for both linguistic groups, our conclusion is that interventions aimed at increasing collective support for Black Anglophones could be beneficial for promoting healthcare access and buffer against language barriers. However, there are some limitations to our study because our results had small effect sizes. Also, we recruited participants online, which means we could not visually verify those who participated, and our study was cross-sectional, so of course, we can't infer causality. Importantly, there are a lot of other factors involved, and more research is needed before concluding about collective support's positive benefits. In conclusion, we want to thank Dialogue McGill and the Healthcare Access for Linguistic Minorities Network for funding this research, the Human Motivation Lab at McGill and the Black Community Resource Center in Montreal are grateful for this support, and we look forward to ongoing research this year. And thank you everyone for listening.